And you are now live.
So, committee, we're taking up 159, H 159, which is the economic development bill that's coming out. And what we've had to do for Senator Sorokin is now dealing with workforce in addition to economic development. In order to keep it within available funding, we really had to make some significant
Yeah.
what is the one, liposuction?
What's that?
Liposuction.
Did this don't you get a haircut?
Or a surgical procedure, but we have the chair of the committee, we have David Hall, and we have Ellen, who is here in person. And I would butcher your last name, Ellen, so if you want to, we'll put you on record and then we can make sure that it's pronounced correctly. So we have basically an amendment here that took that very large bill, and this, I guess, is what we're going to amend the bill to be, and we'll go through the money separately. So you want to, David, I think you did most of the drafting, and then Ellen did the part regarding the tax credit and how we're gonna set that up and sunset. So David, welcome, and if you want to start out with the amendment section, it says striking out section 15, and then we're doing the appropriations here.
Sure. Good afternoon, David Hall, Legislative Council. Are you all looking at a hard copy or a
Yeah, right
copy?
here. And it's draft 4.1.
Yes.
Okay.
Great. Sure. Well, as the chair indicated, really the gist of this of my part of the amendment is to change the appropriation section 15, and then I'll switch it over to Ellen to talk about the downtown tax credit pieces. So you'll see on page 1 here, section 15, subsection A. The purpose of this is to move the money from the ERG program that remains unspent back into the ARPA fund, where it can be distributed from there. I've been working with Steph on the mechanics of this, and it may be the case that finance and management comes back and says they'd like to see, I don't know, some kind of different wording just to make sure the words match the intent. But the intent is, again, to take unspent ARPA funds that remain with ACCD in the ERG program and move them back to the main ARPA fund.
And so be appropriated for a different purpose.
Right. So that's subsection A.
Reversion.
Subsection B, recruitment and marketing. So this is FY 23. We've got $6 million from the general fund to ACCD for worker recruitment activities and for the relocated and remote worker program. The languages that came out of the committee was broken down a little bit further, but my understanding of your request is to have this to be the lump of $6 million for these purposes. And then subdivision 2, tourism and marketing relocation. This is FY 23 to the Department of Tourism and Marketing. It's to be used over a 2-year period. It's 1.2 million to support a regional relocation network and 3 million for marketing and promotion. So you don't have obviously the section of the underlying bill that relates to this money, but it is a regional relocation network program that DTM would spearhead using an RFP process. They would identify roughly 12 regional organizations and partners to have a targeted marketing campaign, state and regions working together to promote Vermont as a destination for relocation, tourism, marketing, etc. So that's B. Any questions on that?
Nope, I don't think so. Don't see any. We'll just keep going.
Okay.
Yep.
Subsection C is $20 million of ARPA funds that would be moved to VITA for a short-term forgivable loan program. And again, the underlining program language is in the bill, but in a nutshell, it replaces the ERG program. It directs VITA to use its basically standard business by business underwriting process to establish a baseline of revenue and expenses, usually would be for 2019. Compare that baseline to revenue and expenses in 20 and 21 during the pandemic. And then based on the program guidelines, they would make forgivable loans rather than grants to qualifying businesses. And those would be capped at either the lesser of a hard cap of 200,000, 6 months of basically fixed expenses, or the amount of their adjusted net operating income. So whatever loss they experienced during that COVID period.
So David, this may be a question for Stephanie. What we've done is we give the 20 million to VITA, and then we say, but you shall transfer 5 million to the Arts Council. Why are we doing a transfer as opposed to a direct appropriation to the arts?
Well, this is a little bit wonky in that it needs to coordinate with another bill that's moving through the process. So whatever verb you use on line 12, I'm not sure. I don't know. I defer to Steph on whether that verb matters. But if 8624 is enacted, then there would be a $5 million allocation that moves from VITA to the Arts Council to administer grants to businesses in the creative economy pursuant to the terms of H624.
It doesn't, if that 624 doesn't go, then it stays for the VITA loan program.
Okay, all right, Senator Sriracha.
Actually, I think the intent was to use H624 as some sort of guidance, but we're probably not going to pass 624. So if it says if that bill is enacted,
And they don't get the money, that's what I'm,
well, our intent was to do a carve out of the 20 million
I know.
for the arts as was represented in 624. And 624 are very similar to the terms for operating grants and VITA, but I don't think this quite captures it.
So do we need something additional that
my
it doesn't
concern is
pass?
if your intent was that you wanted to support the grants of that creative economy in that way, in that 5 million,
Right.
that somehow not, if 624 didn't get enacted, then the 5 million went away and they didn't get that help. And I think
That's not our intent.
I don't think your intent is to make sure that that the 5 million, because there've been concerns, they're smaller grants, they're
Right.
not the,
Right.
so couldn't we?
So would that, we'd be bifurcating subsection C, where it would be $15 million to the VITA program and $5 million directly to the arts, unless, and then you need some description about what.
Yeah, we can do the 20 million is appropriated, 15 million to the VITA refund, a forgivable loan, 5 million to the Arts Council. And then in the creative sector, it's provided, but the problem is if that bill doesn't go anywhere, I don't want to end up like we did with the apartment, you remember VHIP last year. VHIP.
No, I think we want 15 to VITA and 5 to the Arts Council, but we want some description or parameters of what the Arts
Is there something
Council.
that we can lift out of that bill?
I don't know, David, is there something that we can just lift out?
He's smiling.
There's one section of the bill that has $10 million in the first part of 624, which is exactly what this 5 million is for. It's very similar. It's operating expenses or loss recovery expenses. So maybe we can tag that language on.
we can take a little time to do that and, you know.
It says as provided in 624, so there must be.
624 is not pro.
And we just need to import some language in case 624 doesn't go, so that we don't end up with money and the policy, as we experienced last year. So maybe we can find the language and just add it here.
So it's 10 million to cover a portion of monthly operating for businesses that have sustained substantial losses. 2 million for public health related business and 4 million for public health related facility adaptations.
So maybe we can take that language then.
Yeah.
Okay.
it's language
So
that-
you could pull, you could say 5 million for all three of these things if you wanted to,
No, I just want for that first 10 million.
just for that, okay?
5 million for what is in there for 10.
So we'll just separate it.
Rewrite section
So
C.
we'll have the 20 million appropriated and then 15 to the.
You'll create a new subsection where 5 goes directly to the Arts Council
Uh-huh.
to
Okay.
cover a portion of what's in 1 sub A on page 3 of 624.
Uh-huh. Okay, all right. Well, thank you. We'll keep going. Thank you, David. We'll just take you probably, did you write that language too in 624?
Yes.
Oh, good. All right. Well, if you liked it then, you'll probably like it now. We'll just use it. And we'll just move it over. All right. So that's something that you can do
Indeed.
in your, because you wrote this amendment for us. So if you could do that, that would be wonderful.
No problem.
So now we'll go to workforce development. And this is the,
Okay. So subsection D, workforce development, this doesn't appropriate money directly in this bill, but rather provides a statement of intent of the General Assembly to provide 26.9 million of ARPA funds and general funds to be allocated for workforce investment initiatives to address critical needs, et cetera. And the second sentence on line 20, the specific programs to be funded shall be included in H703 or other legislation passed in the 2022 legislative session.
Just a small, I emailed everybody on this section and David as well. On line 18 on page 2, the 703, the workforce bill, is broader than just addressing the needs of nurses and trades and providing opportunities to young adults. So I'm just wondering if we can just say including the fund. So there's so many pieces in 703 that cover other.
I know that some of it's kind of disjointed.
I know, but I just don't want someone to look at this and say, those are the only people we can help. So.
So putting the word including between investment and initiatives,
Is that,
putting the word including between investment and initiatives.
yes, perfect.
Because your intent is to be broader.
Yes, but we haven't finished the bill yet. but
Well, you haven't,
Sure. there's
Senator
gonna
Lyons hasn't conferred sufficiently with
be-
you.
Right, that's right.
You gotta think creatively. That's what we got for instructions.
I gave it till Monday.
Oh.
I'm learning from you.
Thank you. Well, I take that as a compliment.
Absolutely.
Oh, good. Well, when you're working under tight timeframes, you know, you have to, all right, so we'll make that change. So that because that was a topic of concern. And we'll keep going then with E.
Yep, subsection E, downtown development. So again, this doesn't appropriate any new money in this bill, but rather it says that of the amounts that are appropriated to ACCD in FY23, and that could be from Better Places, from Think Vermont Initiative, or other programs that promote downtown development. This gives the agency the authority to allocate up to $485,000 to provide funding to one or more nonprofit organizations that sponsor a downtown designation.
All right, that's on here, Stephanie?
So that it's not new spending, it's.
Oh, no,
redirected
it's,
money.
it's just saying you may, okay, all right. It's just permissive to move the money for that purpose.
Exactly.
All right, so we can go to number one, to,
I mean, E1, 2, and 3 just relate to what the work those entities would do if they decide to fund them. So F, community-based economic development. Again, it is the intent of the General Assembly that up to $11 million of funding be provided in FY23 in other legislation for 2 community-based economic development initiatives. And you'll see on the top of page 4, those are the VOREC program and the Brownfield.
and we're gonna carry those appropriations in the big bill, so, yeah, okay.
All right. And
So I guess the one thing that would be changing in this appropriation compared to what came out of Senate Economic Development is the $20 million for the capital grants are not funded in this appropriation.
I was gonna ask that question. Does that remove the 40 million from the bill that we had in our version? By not saying anything in this appropriation section?
that's correct. There's no additional funding for the CIP in this amendment. But
Amount of money, right.
the program language changes, though, would still be in the bill.
Because there's existing money from last year that you want to.
There's still some money that has to be billed out on this, right? I defer to David on that. I don't know whether that language needs to stay or not.
Are you asking whether the substantive language changing the capital investment program needs to remain in the underlying bill?
Yes.
That's up to you guys. If you want to change the program, you can change the program, but just keep the existing funding structure. This just eliminates the money.
Well, there's no money.
But they've got some they've still got some unexpended, so you
I think
do
they
want to
have-
keep
I
the,
think they have money that is unexpended from last year in the capital program.
so you want to keep the program and allow that money to be
I
spent.
think that's subject to last year's law. We're not going to change the program parameters on applications that were put in last year. Is there any reason to change the program if there's no future money in the program?
That's purely a policy question for you guys.
So is it, would the committee want to strike the section, is it section 4, which is the section that would?
Can we,
I just want to make sure that, that if there's money still yet to be spent from appropriated last year, that we allow that to happen under the rules that were put in place.
Right, and that's what I want to do also, but the changes that I think are still remaining in the bill are prospective to any new monies that were added. The old law doesn't go away for the monies, for the $10 million that they got last year. I'm not sure it's a policy question, David. I mean, if there's no program, I'm asking you, are the changes that are in section 4, are they for prospective money or are they for past money?
If you change the program and then somebody came after those changes took effect, then those changes would be applicable to the new applications after the effective date. Even if it's old money, it's still a new program regime that would be applicable to the new applications that come in after. So I don't know that I have no idea whether they've committed all of the existing money or not, but if you change the program, then after that law takes effect, the new program parameters will apply to subsequent applications.
So I don't want to take away the program parameters.
So
Even though there's not future funding, I need to make sure that what's in the pot can still be
Right.
spent.
So anyone who's applied before this change is made would be under the old, and anyone who applied after would be under the new, and whether or not there's money to carry forward for the new is the open-ended question.
Because the money's all been
So we could.
Is it limited to two
program it.
communities?
So it's not.
And if there's any, then it can be, all right, whatever is left. All right, I think we've circled that around enough.
I ask a question about why is it limited to 2 communities? What if there were enough money for 4 communities?
We're back on page 3, way down at the bottom, yeah.
Yeah.
Two-
I was
Yeah.
wondering,
It's 2 community based programs
Initiatives.
and their development initiatives. So it's the VOREC program and the Brownfield program.
under-
It's not limited to the number of communities.
Why
It's
does
the-
that
There-
communities in there?
No, because VORAC and brownfields benefit communities. We're not limiting the number of communities. to
Okay, thank you.
We're limiting, the funding is for these 2 initiatives, VORAC, of which many towns have gotten benefits, Pownell just got one.
Yeah, I know.
And brownfield, so
So that would be switched so from communities to.
It says community based initiatives.
and those 2,
community.
and the community-based initiatives are VORAC and brownfields.
But VORAC covers all communities
Yeah,
where
take the word
there's
to out.
recreational.
Well, the 2 are related to VORAC and brownfields,
Yes, but
not 2 communities.
But if we list them, why do we need the word to?
Because it's, well, you could say the following, I suppose,
Be clear.
for the following 2 community-based
You don't need-
initiatives.
You don't need the word to.
Yeah.
Well, the word to out.
Change the follow, change to the support
Yeah.
following
Yes,
community.
which
based.
are 1, 2. I mean, it's,
Yeah, that's all right, yeah. Take the
All right.
word to out.
Thank you. I realize I'm a little bit confused about some of this stuff. Given
no, it's fine, we'll do it for the following.
I forgot my provision today.
Okay, oh, all right, and then downtown tax credit,
I'm gonna yield to Ellen.
I figured, so this is, the rewrite, and if you would like to take over then, this section.
Sure, Ellen Tchaikovsky.
There you go.
Tchaikovsky. So I wasn't here for the discussions you had, but I think I've been here previously for discussions about this subject. So there's an existing program called the Downtown and Village Center Tax Credit Program. Buildings within designated downtowns or village centers that are more than 30 years old and are income producing properties can apply for 3 tax credits. There's a bill currently that would add an additional new type of tax credit, but there's an
That's the neighborhood.
yes, and a flood mitigation tax credit. So there's a cap though on the amount of tax credits that can be issued per year. Currently it is $3 million. So the proposal in this amendment is to raise that by 1.35 million, so that is $4,350,000 per year. For tax credits, and then with up to 1 million of those tax credits going to projects and neighborhood development areas. So that is in section 18.
And then we sunset it
And
in
then we-
section 20.
Yeah, well, in section 19, yes, so on page 5, there's very similar language in section 19 that says the total number of tax credits shall not exceed $3 million. And it strikes the reference to the 1 million for NDAs, and it also drops down from 4.35 million. And in the effective date section, section 19 will have a later effective date. So it will be an effective sunset of the additional 1.35 million in tax credits.
And the reason that we do that is because it's a easier way of saying this is kind of, instead of doing one-time grants, which would require a new program, it was better to do it this way and sunset it. So we're working through an existing structure. But it's obviously, it's not an ongoing tax credit.
The limit is coming back down.
So this is infusing it, but for that period of time before the sunset.
Yes, and so in section 20, it does point out that In fiscal year 2023, the amount of 1.35 million shall be carried forward within the general fund to be available in fiscal year 2024 for the one-time increase for the downtown tax credit program.
Because you have 2.7 available in 2023, you're using half of it to up the tax credit for 2023 and carrying the other half forward to 24 to cover the increased tax credit for 24. And then the tax credit comes back down in 25. Doing it with one.
That's a lot of words to do that.
That's Mr. Rockman.
So is David still here?
Yes. This seems to be-
So is the COVID relief fund still in here? I assume it is, but it's not in the
It's one
appropriations.
of the 14 sections. The 8 million and the 16 million,
The 16,
they're in two of this, they're two different, they're not in section 15, the money and then in the section 14.
I don't have the original bill.
Oh, you're talking about the UI.
No, the COVID relief.
Where the two other large ARPA appropriations are, they're in another part of the bill that you're not amending.
Oh,
Okay.
like the COVID wage replacement?
Yes.
Okay.
Yeah,
Yeah,
they had
but-
their own sections.
Yeah,
Everyone section, okay.
so they stay.
Okay.
All right, any other questions, Alan or David?
I do just want to quickly say that, so there's the two sections because they have separate effective dates. And since we're doing an update to this amendment anyways, I picked the wrong effective date, but Stephanie and I caught it. So in section G, in the effective date, we're gonna change that to July 1, 2024. So that we make sure that the correct this change is for the correct number of years.
The H is still at 22.
Other comments or questions? So what we're gonna do is, David's gonna rewrite that section of C to split it into two parts so that we're making sure that regardless if H624 doesn't move forward, that there's language that goes with the 5 million. And then we'll change, just making it clear that we aren't talking about two communities, but we're talking about two separate pots of money to assist communities. And then we will change the date. And thank you very much, Michael.
Michael, can I just ask something, Michael? So just,
Oh, where is our sports betting language for the expedited version?
is this,
It's in there someplace.
It's not in this bill. You want to add it?
yeah,
This has
Is
to
it
start
right?
with-
Right. Get covered. I can send it to you.
Is it,
We got
but
the
this has to
horses.
study.
We have a study on it.
Yeah. I thought you were
I was
just
gonna
gonna
put that on.
Oh,
And
okay.
keep the study, both,
No.
because it,
the real bill.
no, but are we, if we do the expedited sports betting, should we get rid of the study?
No, just keep the study there just in case you have to go.
Okay, can I ask you a question about this one? It's the increase in unemployment benefit. Is that on the?
So can I ask
The bill.
anybody here who's
Is that something?
Oh,
okay, right.
which is what we passed last year.
Thank you.
Yeah, all right, thank you.
And your excuse, thank you.
All right, so we will get the amendments and then we will, then we can take action to move H 159 out as amended by us and the money. And if you want a sheet that takes the money, do you want a sheet?
Yeah, sure.
For what to do. I'll update it tomorrow because we're splitting that $20 million into the 15 and 5. It's not, it wasn't split on that sheet.
We don't.
But you can,
Do you wanna, so can I ask a question about the amount of the D, page 6 of this amendment? Is the increase in unemployment weekly benefit amount, is it $25 that will be to everybody? But
It's
each
for
one,
dependent.
it's for each dependent?
It's exactly the same rules that we passed last year. I can't answer that. Here we go.
For each dependent? Everybody else?
It's in the original bill.
so
So
the
I can,
effective date
Yeah.
the underlying section.
Yeah.
So, and you're asking about which piece of
I'm
the
asking-
effective
No,
date?
it's asking about whether it's $25 per family, per claimant, or $25 per dependent. And that's in the underlying bill,
You mean that-
159.
Okay.
We're not amending it, so whatever,
I just wanna know what it is.
well,
We have a big bill from me, it's 71 pages from yesterday.
right.
I'll look at it.
Okay.
Senator Kitchell?
What?
For the Senate Secretary's office, are you guys planning on voting that out tomorrow, or are you gonna get back to it today, just so they can be on notice?
I don't know if David's gonna have it ready. We've gotta have the final amendment before it can be taken up.
He's left us.
He's left us, so,
Do you want to shoot David a note and ask him if, how quickly he'll have the amendment?
Yeah.
And then we can decide.
Decide, you bet.
and, I have a copy of the bill.
It's section 14J, I think, that we took. Yeah. She was asking.
Oh, here. Well, and then it's blank after, it's on page 60 of the original bill. And then it says weekly benefits, and then you get the 3 asterisks. Oh, wait a minute, oh, here. Here it is down, see, it actually shows up at C. E shows up there. And $25 should result in quotient.
Yeah.
So it's not for dependents. Is it?
It's an open question.
Well, that's on page 58. And it says, shall receive a separate supplemental benefit of $25 pursuant to the provisions of this chapter.
He asked for the study from the Sheriff's Association. They studied with the.
So if you have the chapter, that puts it up, like,
But then when you
statute
look-
up online.
When you look on page 60, look at E, weekly benefits. It says,
Well, that's weekly benefit, so that probably has to do with the calculation of the basic benefits. Maybe, I don't know.
$25 result in quotient.
Does it have the reference to the statute where you can reading that?
Yes,
like,
well, it says 21 acts and results, number 51, section 11.
So that's section one.
Yes.
Act 51.
It's on page 57. The General Assembly initially enacted a 25 supplemental increase.
Right.
25, it says 25 supplemental increase, so it doesn't seem like it's each minute, it's to the benefit.
So what section of?
It said
Number 51.
Section 11.
Yeah.
Maybe somebody can look that up while we get it
I'm
going.
doing it right now.
All right.
Weekly benefits.
It just says a temporary $25 increase in the WIC, the weekly unemployment insurance benefit. So it seems like it's a $25
It wasn't-
add-on to the.
Yeah, it was not based on the dependents, it was add-on to
Just
the
add-on.
individual. So we switch back to the base now?
Yeah, we'll just go back to it.
And if I could give you an update, David Hall will have the revised amendment in about 15 minutes, so you can pick it up, you can vote it out today.
Okay, so now we're going to back, and then we'll vote out 159 once we get the revised amendment. All right. So now we're on to base.
The FY 23 general fund base, which we know we walked through the web report earlier in the week. And this is a worksheet that is sort of an internal I do this a lot every year where you have my best estimate of where things stand, where you sort of put them in a more solid.
I love the way of organizing.
I keep one for myself, I'm sorry. Good idea. And then other asks on the side, I did not include some of the asks like the $20 million for corrections and the $10 million for working lands. This is simply my summary in one page of the sort of more live asks that are in the base. There's a much longer list on the one-time list, which we'll get to tomorrow.
This is our first cut of prioritization.
Yeah.
And then there'll be more to follow, but this is sort of getting us into some agreement about what we would want to make sure was in the money and not say, well, and this is all we have left and we've already committed. So this is, and if you disagree, we'll take it apart, but let's go through it.
And this is in relationship to the House passed general fund budget. So one of the things I was struggling with was the $10 million to housing that the House included. We talked about that. I've assumed that that's in. I haven't made it as a -10 here to the side. But we could talk about that, the question of whether or not you do it directly as general fund dollars or you do it through, where we notwithstand, which is the way the House did.
Okay.
And for reference, the long sheet that was passed out several weeks ago showed the general fund base that the House passed relative to the governor's budget.
I'm appalled, but that was my son asking what I would like for takeout tonight because we were working late. And so it was a very important call.
Oh, I guess it will be.
No, I got home delivery on this. Okay, sorry for the interruption.
This list of the things that have zeros or a note or an ask on the side that are not in the column yet. That's the sort of the goal of and the target overall for the general fund compared to the House's total of base general fund spending is $13 million, I believe, $13.5 million. So that's so you would have $13 million more to spend than the House, and the list of things that I'm showing here, some of them are must-do, some of them are sort of
top of the list
items. Total 11.1 right now.
So we have a very long list for what's available if we agree with this. So why don't we just
start? So we just walk through, and then obviously if there are things that are not listed here that should be, please let me know. I didn't intentionally.
I'm wondering, and maybe I'm just misunderstanding what this exercise is. Are these only things that are currently in a bill? Or
they're either in a bill that has passed the Senate and they must be done because you passed the Senate.
Yeah.
They are an item like the fourth item down, which you have said you have a high priority of trying to get 1% more. The House passed a 7% increase. You would like to get to 8% on the designated agencies and home health.
They like 10.
You'll catch on actually start going.
Okay.
So
this is just the base side of the general fund equation.
There are things.
Chrissy, send me a copy of that, please.
Chrissy, it is, if you look under my name and join, and I'll
So
send it.
this doesn't include any.
Can you send it to me too, Sarah?
Yes,
No, let's be clear. This is base
I
general
don't know if
fund.
there's other tabs open in there.
We will deal with the one time.
And if an initiative is in the House budget,
Yeah, we closed out, then it doesn't need to be here.
It does, if you're agreeing, we're in our walkthrough, I pretty much assumed that you agreed, or it looked like you were agreeing with the House position. There's no change to the House, so it doesn't show up here.
Okay.
So like, so State College is $5 million. You basically agreed to that.
And then state colleges will show up on the one-time list as well.
It's for the bridge funding, but the base for state colleges would be just closed at the House position.
And we're gonna, and these are an attempt to distill what we thought were key issues. You're gonna see one down, how we're dealing with that Victims Advocate Fund that is structurally in deficit. This is our attempt to deal with that. So Senator Sears, you can see what we're proposing here,
I have a copy of the document, that's.
well, Sarah Clark is gonna do it, but why don't we go through and then if somebody says, I absolutely object or I wanna set it aside, this is our first cut and start organizing.
And
we'll make it-
to get the base a little bit more solid so that we're down to an even smaller group of things, decisions to make.
So the first one, we feel we don't have, we had that study done of legislative staff, we have salaries that are out of kilter in terms of equity. And this is the money that would help deal, along with the Pay Act, that would help deal with the fact that the result of that study is we have
This
positions.
implements the result of the study.
Yes. And which comes with a cost, because if you've got somebody who's 1/3 below what somebody else is getting, you have to make this adjustment, so. All right, so the time, per parcel, we already passed it, so that's no choice. The direct care workers, we have to pay them, that they're under contract. So that is a labor cost.
We got no choice.
I got no choice.
That's on.
The next one, do have a choice.
We do have a choice, and that is if we wanted to try to move forward with our DA system, SSA system, and move up closer to the requested 10%. This would fund 1% from 7, which was in the House, to the 8%.
That's probably, I mean, I don't know, 10, but
We don't have the
that's
money.
probably the best we can
Well,
do,
we
so.
can go one, but I don't think you'll find we're gonna have the money to, but we can go through. So that's
So
what,
do you want me to leave this?
I
put
can
this
leave it
in the-
open if you want, for now.
I would,
Not knowing what the whole scope of everything is, I wanna
We'll
be,
hold it.
I wanna be above the house, but,
I'd leave that open in
Yeah,
case
all right.
we run into maybe some marijuana money or something.
Well, I don't think
no,
we
I've
will.
already spent some of that.
So the next one
Well,
down.
you haven't spent anything yet.
You watch.
Well, until the committee says that's where it'll end
Well,
up. I'm sure your case will be persuasive, but,
it will be.
but
You're gonna say yes.
And Senator Sears, have you received the document yet?
you're muted. So,
Okay, all right.
so now we're moving on. We're gonna hold that. This is where we might pick up some money. We had some discussion about the 10 positions in Dale.
Yeah.
And Stephanie did some work on
I
that.
went in and looked at the details on the positions and said if you were gonna do 6, and I just guessed that, you wouldn't do the new manager, you'd only do 1 new investigator, 1 new OPG person, and not do an assistant, but you'd leave 6, the nurse surveyors, 1
Yeah, let it go
investigator,
I
and
would,
1 OPG.
I would leave this open. I would tell you that 6 of the 10 positions do the reviews for the residential care homes. And from my point of view, in that, and I think,
We're
the
gonna
chair
change the
has made,
language.
has made, a pitch. I think we need to have that general discussion around it. We'd rather put the money into rates than put, into employees.
So that what this is reflecting, that 360 on the side, is if you decide the budget as it comes from the House has 10. If you decide to only do 6, and it's the 6 that the 4 that I have sort of identified from the list, you would save 360 to help in your.
But the difference is in the,
Would you want to get rid of all 10?
my,
All right, well, then,
Okay, so that was just so that's,
this
do
was
you
coming
want-
up, if you took those more administrative as opposed to the people that are going out and doing the actual view, the surveys and review of the facilities. This is what you could save if you peeled those off. If you want to say, no, we don't want more positions to oversee a system that's on its knees, we'll put the money there. We can hold it.
I mean, we do have to make some actual decisions, right? Right, you're at a point where this is the base sort of,
Yeah.
we're trying to get as many base decisions decided here.
no,
So we could carry the whole negative, we could take away all 10 new positions and carry the negative here for the next round. if that's where you wanted to be for the time being.
Yeah, so that's what we have to decide. This was saying,
No,
I was just- I was
get
making
what-
a suggestion
I get
of
what,
the-
I get what you're saying, and
I guess the committee needs to decide at some point, do we in fact feel that the staffing that we have to do the quality, the survey and certification to make sure that people are being cared for adequately in these residential facilities is at a level to protect them the best we can.
Are we getting a lot of complaints about the people in care? Do we know?
I haven't received.
If you don't, oftentimes you wouldn't know unless you're going out and surveying. And I would.
People whose relatives go in and see the people.
Yeah, they do get complaints.
they do get.
I know they do.
And that, but the review now is once every 2 years, and that's not,
So I guess the thing is, you say, well, if we don't get complaints, that means the care is good.
No.
No, but I will move on. We can hold the 10 positions. This is if you want to at least make some progress and split the split the difference. This is what it would free up
It was
to be moved.
Sort of that.
I'd go for freeing it up. Maybe it could go down to.
All 10, freeing up all 10 positions?
No, I'm not saying that. Certainly,
Well,
certainly you've got 6 left here, right?
we have 6 and they're the more direct,
So why don't we split it and put 5?
Well,
let's come back to it.
I think we need to come back.
Richard just wants to come back to it.
Let's come
I
back.
wanna come back to it, see where we are, and
All right, so we're gonna have to run through this and then we're gonna have to come back.
Yep.
The conversion factor from Medicare, that's for primary care. I feel we have to do that.
You actually adopted that in budget adjustment, we just forgot to pick it up on the House side.
PNMI,
Can I ask about PNMI, the Howard Center?
that's what I'm coming to.
Yeah.
PNMI, that's rate setting, and it's not only for the Howard Center facility, but it's also for the group homes for children in DCF custody and some other programs. And so what we're proposing here is, because they aren't subject to the 7% or 8 or whatever we agree on, it's the same language we did for nursing homes, and that's to deal with the fact that their base year for their rates is 2019, and the costs are so much greater.
Yeah,
So this is how we would address the cost.
and I just can't remember what the language was in the BAA that it's similar to.
Well, it's what we did for nursing homes to accelerate the rate setting so that
Okay.
those costs get recognized
Okay,
and the base year gets updated.
So we would make
Faster.
the same directive to the agency.
So it's treating those other rate-setted entities the same way we did for nursing homes in the BAA.
okay.
And just
so
be
this
clear, the
addresses
impact of that would
their-
show up in the
Yes.
budget adjustment.
That's what it's designed to do. And the
Unless
group
it could be
homes.
somebody in on the.
So I wonder, would this include Mountainside, which we had a letter from in regards to, which is a teen shelter and food home?
I don't know if they're PNMI facility. I don't know. If they're subject to rate setting, then it would.
So we're gonna vote for it.
Well, it's really saying that the costs have accelerated so much from the base year of 2019 to wait for the next 3-year cycle. Their reimbursement is inadequate to cover the cost. And that's the concern the Howard Center has raised, but also our group home facilities for, the kids in DCF custody.
When we keep saying the Howard Center, does that mean other facilities similar to the Howard Center?
Well, the Howard Center is a DA and but they operate a residential facility that is rate setted.
I see, so it's like HCRS runs 2 residential facilities that I know of. I mean, are they included there?
For DCF children or for disabled people?
Disabled people.
They're
That's under
coming,
DS.
they're under the DS.
Yeah, under the, yeah.
So So they would get the 8%.
And so with the DAs, because they operate facilities for people with severe mental illness that can't be adjudicated. So these are the ones that are outside that,
They're a rate setting position, so they will go through the rate setting process.
so it's language that point up. And there's no money because you don't know that until that rate setting review has been taken. But it probably would result, by the time it's done, in a budget adjustment. This is SUD recovery.
So I made an assumption here, and I'm just looking at Senator Westman actually, that the base SUD recovery package would be the same as the House. I think you might be working on something on the base level to add to it.
I've got a different chart. And
So you
we're-
want to change the base?
Well, the difference between the total base spending and what the House did, for a whole package that we have is 7.35. And what I'm running with this number is 7.5, so.
You know, but there's a base portion and a one-time portion, and what we would
Well,
cover
the
here is
base,
the different in the base.
In the base portion,
You're agreeing with the House and then you're building from it.
no, the base portion, I'm 700,000 over.
So we would carry, if the committee is agreeing to the proposal, then you would carry 700 here, where I have the zero.
All right, but that's just part of that future discussion.
Yep.
At least you don't want to go less than what the House did.
No,
It's 800 is what you have proposed.
so,
807.
yeah, it's 5.7 versus 4.9, yeah. Yeah, you're right.
Don't argue with Sarah or Stephanie. Childcare.
So you adopted that language earlier, so.
Yeah, that's the directive.
Yep.
Okay, so
And you also adopted the adult pay language. The adult pays will get the 8%. but-
Yep, you put this CTE language in base. This is and
no, it was one time.
No, I wasn't quite sure what you were, you've done it at one time.
we put it in one time.
So we'll take it off this list, because
Okay. This
it's
is
addressed already.
All right, well, it's addressed already, so it doesn't, and it's not part of the addition anyway, so.
Yeah, and same with the adult days, that they're getting the 8%, but the reform.
Well, if we agree on 8%.
Yeah.
All right, there's been a lot of discussion, and the House did not do this. I don't know, we can, it's not in the column, so to speak. And that is to increase the personal needs allowance for people in nursing homes.
Can't we do more than that?
Okay, good.
Well, we haven't even got it. We have to agree that we want to even do that much. It's something that's not in the governor's recommend, it's not in the House.
This is the poorest of the poor.
I understand exactly who it is. Do we want to agree to fund it
Yes,
now?
please.
Try it. We have.
All right, now, the other one is out there, and that was the increase, this would be a base to the parent-child center.
And your ask from your committee down the hall is a much bigger number, I believe.
Well, we had the bill that moved out, and we stripped the funding because there was one time, it was 3.7, I believe, in funding, and I don't remember the base, 1.3 or something.
It's 1.5 in the base.
1.5. So,
If the
And
committee
this-
is comfortable, I'd support that.
Me too.
You'd support their ask for the base?
No, this.
1.2.
So this
This
is
is the base.
100,000 below what they wanted for the base?
They wanted 1.5.
1.5.
Oh, I see.
It's only 300.
They also wanted an additional 3.7 in one time.
And we'll consider that when.
You get to the
The
one time.
3.7 would be on the ones. And the reason, it seems like this would rise, because there are other
Yeah.
efforts to throw bureaucracy at a system that's weak. But the UVM studies that as a state, Vermont was not investing as much in prevention and supporting families so they don't have, their children don't end up in state custody. And one of their recommendations was the work that parent-child centers did. One of the things that we might want to consider is linking this money with, more with efforts to support the families whose children are at risk of entering custody. I know that the one in St. Johnsbury they've been working very closely with DCF because they have a goal, they want children protected. And so we may want to think about language that links closely our efforts to reduce Vermont being an outlier, bringing more children into custody than other states.
Agreed. Can I ask why, if they wanted 1.5, we're considering 1.2?
I think there was some different, I think I just picked up a different number from another list of asks. The 1.5 was what was in that bill that came through us.
Was it?
Yes.
All right, so we want to make it 1.5.
Oh,
Based on
I
what you
don't.
just said.
Well, how many centers are there? 13?
I don't know.
Oh, probably the
15 centers.
15. That would argue for the 1.5.
Yeah.
Okay.
So we'll carry that in the column.
What'd you say, Dick?
I just wanted to say, I'm fine with that for this first round.
All right.
Which, the 1.5?
Because I know there's another bill, and that's to create an advocacy office. And that, I know some people have different feelings about whether that's where you want to put the first dollar and how you support families most directly. So we'll move that right now to 1.5. The child tax credit, I don't know what the committee across the hall is going to do. Even if it's at a reduced amount, you still have to administer it. It is a refundable credit, which means people are actually filing and getting money back. And so that is, if we do something with that bill, which is different than normal tax preparation, this would require some administration. So a lot of whether that's needed or not is going to depend on whether finance agrees, and obviously,
They go through the existing system.
or whether they've had some discussion, would it be better to do more through the earned income tax credit, which is already an established program? Would it be better to provide some kind of a tax deduction for the families that have out-of-pocket childcare because their incomes are higher than subsidy? So they may have a different approach entirely to how you want to assist.
That's a big bill there. That's going to cost us a lot of money.
Well, the way it got passed in the House was a $48 million reduction on revenues. And that's why I went next door with Stephanie and said, we can't really address some of what we see are critical budgetary needs with that level of revenues not available. It's like creating a whole new program and using the tax structure to do it.
Isn't the earned income tax credit refundable?
Yes, it is.
So why would we create a?
That's the conversation across the hall. And it's indexed, and there's a federal tax credit too. So there's a, so it's for people who work. And that was part of that whole, when we did welfare reform 100 years ago, when I was younger and weighed less. That was part of looking at how we support families outside the public welfare system and how you support and incent work. And because there was such tension at that point between families who were getting benefits and those who were working and still low income. So that there was a lot of emphasis on those programs, including childcare and also healthcare. So that was when we did Dr. Dinosaur and expansion, and all of that was to support families.
Well, suppose, and I don't know if this is.
I would hold this and.
So we have to at least acknowledge that if that moves forward, it's gonna have administrative support. Environmental justice, I think we have a typo here, but, we moved, we had the mapping.
The mapping's on a one-time list, the change in B 700, -100 is because it's carried in the 200 that's in the base of the S 148.
So
That's related
otherwise
to
it would be
voting hours,
twice.
And then the same with the dual enrollment, it's what we have to carry based on the estimate.
What about environmental
Justice.
Well, we've already passed that bill out. It's over in the House. We reduced it, I think, from 20 positions to 3. And funded the mapping. I know.
So you have to do that one, you passed the legislation.
We passed it, so, and the same is true if we wanted to do the same for dual enrollment, because that would be the general fund piece.
And that language gets imported into the.
If that bill, then we would do the 150, I guess, we appropriate the ed fund too. Yeah, this is just general fund, so yes. So there are a couple of things that we have to think about at the very end.
So I carried the 1.7, which would match up with the cannabis construct that you just approved. Is that's the impact to the general fund. It's actually not an appropriation impact, it's a revenue impact, because the direct tax is lower than the forecast amount for in the net. That's the net impact. And the next one is the victim advocate, and this
And Dick, you probably want to pay attention to it, because this is how we would really begin to make progress on that structural deficit, by moving the positions.
So we would move the cost of right now, the Center for Crime Victims bears a expense in its budget of $2.5 million to transfer over to the state's attorney to cover the cost of the victims advocates. If we take that expense away from the Center for Crime Victims, you have solved 2.5 of their structural problem.
Right.
You have to appropriate you're putting it onto the general fund by directly appropriating general fund to cover the cost of the victims advocates in the state's attorney's office. That means that the $3.3 million that the House has taken out of bringing the special fund down, leaves them only with $660,000 as a gap for 23. So that's still a deficit, but it's a much lower deficit. And so I carry that 660 over on the one-time list if you do this here.
I think they will be opposed to moving the victims advocates, but I think you're moving the money, not the position. I mean, the positions are
already
already.
exist under Annie. The money always exists in the center, and so we can have language that addresses their concern around the victims advocate.
Most of the federal money goes to the victims advocates too.
The VOCA money.
So on their for 23, they were showing it as
Yeah, no,
I do it out of general fund, and so this does do it out of general fund. If you look at their
Did
sheet.
get an email opposing this from them, I believe, but I think it's something I'll have to work out.
So I
with
think
them.
that I don't think it's the loss of the expense that they oppose. I think the concern is that over time, could the state's attorneys start to defund the victims advocates? I think that's the concern.
Yeah, you're correct.
Frankly, that can happen to anything if we allow it in the budget process.
And so we could, we can have, I think the state's attorney's office is willing to have some sort of MOU around,
Well, I think that would make,
proposed change to victims advocate.
It
That
seems
would
like
help.
this was something you proposed a long time ago, because
Yeah,
we had those
it was.
fights between,
Where they wouldn't be allowed
well,
to.
it was, the former director was more problematic about some of these things, but I think if there was an MOU, that would be helpful.
We could direct them to develop one with the
Yeah.
change in the funding.
Yep.
this is actually stabilizing the funding for the positions, and recognizing the fact that it's an ongoing cost.
I believe the victim advocate serves at the pleasure of the state's attorney, so.
Yes, I believe that.
That's the case now. It's just
So we're moving the funding where the positions are. If there's concern that somehow the state's attorneys wouldn't value or those positions, and they would be the ones that would be, I don't know, fall victim to the budget, we can put something there. But they're falling victim to a deficit as well.
It's
not
not
as
on
a
the
current-
center side, it's not on the
Yeah,
state's attorney side.
That's right, so,
So we would take, we would just replace the interdepartmental transfer.
We were to look at one-time funding of the remainder, 660,000, that would, I think,
That's what, the center would get 660 in one-time funding in 23 to be whole in 23. But that does still leave a deficit, and the underlying source of funds into some of their funds from the fees and surcharges is still a very fragile and weak and declining probably revenue source. So it solves a chunk of the deficit. It does not solve the sort of structural trend change in either the volatility of the federal funds or the fee structure that underpins them.
They may get more in a non-COVID year, police will stop more people.
In the long term, if the fleet of cars of the nation have more and more artificial intelligence in them, we are only gonna have a downward trend probably in
That's
the long term. If
additional
you're gonna
fees.
avoid
or
fees.
whatnot. That's right.
I mean, I think that's a long-term change, but that's the ratchet of it.
That's
So,
assuming that the program was.
Dick, you're saying that the center doesn't like the fact that we want to fund the positions?
I'll talk, I'm sure I will hear from them. I think I think the MOU would be helpful.
All right, well, this is a way of dealing with a structural deficit, and provides a fairly significant commitment of base general fund.
And it's very, in current fiscal 22, you have provided $3 million in two chunks, once last year and once in the budget adjustment.
Yeah, the House merely put 2 million into the one-time list, right?
They left 1.3 as the
Yeah, I would say putting this on the way we did is a major step forward of recognizing that we had to deal with a structural deficit. And if we valued the work of the victims advocate in the state's attorney's office.
And the direction of the center.
Right, and
Yeah,
this is our opportunity to do it.
I think it actually, it's a long time coming and I think in memorandum of understanding, they can work
All right,
with.
so with an MOU. Well, they must have some memorandum already. If
I would think.
the state's attorney's office. I just remember when there was a COLA and the salaries went up and they weren't funded and we had a it was horrible.
The center never got the funding, but the demand on their, what they had.
I appreciate the way you've worked this out. I think it's important that we recognize that the current funding structure is just not going to work, and the fines may go up. They're not going to go up to cover the 2.5 million that we're talking about here.
So I think maybe it would.
Just say fine revenue. Surcharge.
It is going to be a declining revenue, and so we still have the revenues. I don't see them really bouncing back.
No.
It might come up a little, but the long-term trend is probably not great for this source of revenue.
They could possibly cover the $660,000 deficit.
Well, that's what I'm thinking, but I don't think it's going to bounce back to cover 2.5 million in staffing. All right, court security, and I thought we changed the percentage on that.
So the court security ask is 1.25 to cover court security at that $50 rate to the sheriffs. The language that you have accepted and put in the bill regarding the state paid deputies and the ability to use them. And this is purely a guesstimate on my part. I was saying I'll take that 1.25 ask and say that the use of state paid deputies should take some pressure off that ask. And so I
thought the 750 though would get us more to like assuming that a third of the
So
Need would be met through the reassignment of existing state paid deputies. Let's only be 40% of that.
if there, well, it takes 40% of the pressure off, so 60% of the pressure remains. It would have to be around 850, it should be about a third, I think, for each.
Well,
Three
the
seven.
the 750 and there is actually
If 750 in the governor's proposed, so increase, because they originally, when we met, I thought wanted 1.5. And we
right.
had, and they asked for that, the governor said 750. And then you had your meetings with how they could use the already funded state paid deputy positions for court security. So it was thinking that that would relieve some of the costs because they're already.
One of the things that we're looking at here is to have one negotiation between the judiciary and the sheriff's executive committee. So you don't have 14 different rates.
So my question, well, you need language to do that.
Oh, it's already in the bill. It's in the
That's what I
language
thought.
that we,
That's what I
Yeah.
thought. So this is what we were thinking is what we would add to the 750 add-on that's governor proposed. It gets us to 1.5, and then just for the sake of assuming something, that the gap would be made up with the ability to reassign to state paid deputies.
in the auditor's report, 40% isn't a pretty good number, Stephanie, actually. You know, you look at how, you know, particularly in Chittenden County with 6 state paid deputies currently, and you look at the number of transports they're doing, you know, it's way down.
I know, so it could be a little bit off, but we thought it was a reasonable assumption for this purpose. So, all right.
Well, I think the additional 750 over the governor, it helps ensure the court's reopening, I think.
Plus the the flexibility on those positions.
Yep.
There.
No, I think that's,
Yeah.
if the committee can approve that, I think that goes a long way towards reopening the courts, which when you talk about priorities, obviously civil justice is a priority. I mean, it's something the government has to provide.
Okay, so we'll go with the 750.
Trying to do that to get to the Senate Secretary's office.
So I'm going to take just a quick break here. And you can, while I'm doing this, here. What we have now, David Hall's finished the amendments to 159, so that we can vote it out in the Secretary's office, so that we'll see if we can get through this.
Section C.
So on page 114 of page 2, where the
Creative economy grants to provide, and this is taking the language that was in the bill that may or may not pass. So we've got consistent language. So that takes care of that. And then we needed to make sure that we said for the following.
Yeah. And then one other place where it was included. Oh, that's in the workforce. Yes, he's got including on line 21 on the bottom of page 2. And the following.
Critical needs other trades.
And the other point was at the very end of the effective dates was
To change,
July 1, 2024.
and that was done. I hope I've got, yes, it's been done. So, I think we have, our clerk is getting ready to clerk.
I am all right.
So, do we have a motion to move the amendment? Seconded, Senator Starr. So, we'll, unless there's further discussion, we'll call the roll on the amendment from this committee.
Senator Ballard, Senator Baruch, yes. Senator Mitka,
Yes.
Senator Sears,
Oh,
Senator Sears,
oh,
I'll hold it. Senator Starr,
Yes.
Senator Westman.
Yes.
Senator Kitchen.
Yes.
We'll just wait a minute for Dick to come back.
He's
I'll
back.
bet. Dick, we have the amendments on H-159 from David Hall. And so we've confirmed that the changes that we talked about have been made. So we are voting on the Appropriations Committee amendment at this point, and then we'll vote on the bill as amended. So do you want to vote in favor of the committee amendment?
Yes,
Yeah, okay.
All right. So,
Okay, 601.
and now we're going to entertain a motion for moving the bill favorably as amended.
I will.
Okay, Senator Westman has moved, and Senator Starr has seconded.
And Senator Ballant. Senator Baruch. Yes. Senator Nitkamp.
Yes.
Senator Sears.
yes,
Senator Starr.
Yes.
Senator Westman.
Yes.
Senator Kitchen.
Yes.
And who's the first?
So, do you want me to report it?
Oh, it's Becca's section.
Okay, I'll report it.
Can I ask that you just
Yes, I will.
quickly sign this and I'll get it up to, they're gonna come pick it up for you.
Yeah, you tell them to come down because I'm not waddling up at
There you
this
go.
point.
Great, thank you, sir.
Yeah, we'll strike out that very first item on this sheet if they don't come and get it.
601.
Yes. Thank you.
Okay. All right, we're gonna keep going, cranking through. All right, so the next one, put it on because we got communication from Department of Labor through error, the base funding for their operating system. The House reduced it by 500,000.
Well, the one above that we talked about yet, and that was, we have a request
Oh,
from
yeah,
the
sorry.
March Community Justice Senate crowd asking for $1 million. The question, I don't know if it's a base request, but you did talk about Justice Reinvestment 2 investment and the permanent sort of pressure change. So I don't know if you wanted to view that as a base piece, if you wanted to think about that as the one-time item and then address through the Justice Reinvestment 2. But that's one.
I think we probably need to hold that one for right now. But we did have the language that we talked about that made it clear that we could use the savings from out-of-state beds in the construct of justice reinvestment for those front-end activities that have been really successful in reducing our incarceration rate.
right.
So there's a potential source of funding to help support those programs
Already.
coming in through future out-of-state bed savings. But we can deal with the one time in the base until we can look at that funding source. So we'll hold that. I think we have no choice. We have to give DOL the money it needs to operate its UI system or labor exchange. So that was a mistake. We said we were going to agree, and then Commissioner Brown came in and said everybody.
98% of all of the doctors that make an assessment on this, they just rubber stamp what the doctors.
They do, and because they defer to the treating physician.
Yep.
And so we're going through a review process that yields no real change in eligibility. So we'd already decided that we would concur with the administration.
Move that one over to the column.
But we just moved it over. All right, working lands, this is a fairly significant addition. The governor raised it up to $1 million. And then the House said, well, we'll raise you another bit, you know. So this would be $1 million on top of the governor's proposal to raise it to $1 million. So
We agree with the governor.
well,
If you carry the negative.
if we
million.
carry it, then we can come back and look at, would we want to expand this program versus, I don't know, Bennington Pathways, for example, or the free clinics that are asking for an inflation adjustment.
Well, but the governor gave an increase.
The governor gave an
And
increase.
this is the million that the House put in on top.
Well, they wanted 50,
Yeah, but
And I do believe you can article or general fund for them. in
What?
EAA.
working lands has a lot more applicants than they do money, and they always run short.
Well, we have a lot more applicants for funding than we have money, Senator Starr,
Well,
and they're all worthy.
give me the list, I'll call them. Tell them we had to give it to working lands.
All right, you wouldn't give you a few here. Call some of the nursing home people and tell
So I
them.
told them we were gonna give them an
You're telling everybody. Well, that's how you're funding it. All right, and then we have, this was a new program. This was to create helping people, providing tax assistance and benefit assistance. Some of that,
I don't know, that would have a lot of volunteers who do it.
well, we took it off for now as, that was in the House base. So by not agreeing to it, it freed up $400,000.
Did you move working lands to the left, or do you leave it where it is?
We moved it off. We did not, we're saying the House expanded it. At this point, we're not agreeing to it. We are saying that $1 million or the 400,000 for startup of new program. We want to consider relative to how well we're funding existing programs, or would that be our priority? So that had been done. We have had, I don't know if all of you have been getting it, but obviously the folks in Bennington are well organized, because I've had a flood of emails as to why we should have a pathway program.
Yeah.
The only thing I would say is I believe there are other areas of the state where that service is not available. So we're
There are there's 6 programs currently, 6 counties have programs.
Yeah, they've been, ever since they had those chemicals, they've been.
So, those are, questions.
I'd like to just speak on behalf of that. I mean, we've got a tremendous problem of people with significant mental health issues or substance abuse issues that are not part of the Department of Corrections housing plan, and it is an acute problem here. This is 30 beds or 30 individuals, and it's been proven to be a fairly successful program. So I'm hopeful that we will be able to fund this.
So it's not a new program, it's really incrementally getting the same level of services to all regions of the state.
Eventually, I would hope. And we have, right now in Bennington County, they have, I think, 15 beds for corrections.
Well, I'm gonna,
Pathways.
committee, are you tentatively, we should move it and say we would like to get this same service. It's to help people maintain housing, and they oftentimes have mental health diagnosis, or they have come out of corrections and they have substance use. And the research shows that getting people housed is one of the first steps to, right, it's a housing first, that's what it is, and it's supporting populations that are high risk of losing housing. And
we have had a trend of expanding it out.
yes,
And I think Bennington's a good place.
So they need,
so this would move that program, expand it into, get the people in Bennington County the same service that exists in 6 others, and maybe eventually we can get all parts of the state that same level of services.
there's a prison down here that, where they.
No, there isn't. So if we want to move that over, your district may be next.
Yeah, Sheridan must already have a couple of these.
Does Rutland have one, Dick?
I don't know.
They wanted one. I think it might have happened, Alex. Yeah, it was on the wish list.
So where did?
I know Washington County has one, Chittenden County.
Washington County seems to have all of things.
Well, as long as they aren't going to Newberry, I guess I'll support.
No, they're not going to Newberry, Bobby.
The House put, legal aid, and they have provided, been in business for, I don't know how long, to provide legal services to low-income Vermonters. And the House, I believe, gave them base of the one-time money, but if you're hiring attorneys, you're providing legal services. And the level of funding increases has been rather pitiful. And this has been a core service to people who need help with housing or other legal issues.
That's the BLA.
Yeah. So I feel that it's been a core service for many years, and
So this would cover the healthcare advocate, right?
And the base of.
yeah, it would, instead of one time. It's an ongoing service need, and one time, if we can move it into the base, we're recognizing, in fact, the need is not, it's not kind of a temporary one-time need or service.
Going away.
Yeah, UVM, HIV/AIDS, is that in your construct, Rich?
There's money in the contract for AIDS in a number of different places.
I know.
I'm looking, and there,
This is not in the House budget.
There's not, it's not in the house, this is
Not-
separate from the AIDS pieces that were, the HHOE service pieces that were in the house budget. This is directly from UVMMC.
And I think it's really right, the mobile
I
outreach on
think
their
it's a
part
new
is new.
program that they're offering. I do have language on that.
Well, the question is,
Uh,
I'm gonna suggest we consider it within this package as opposed, because we're getting kind of ad hoc. And
I think Virginia might be able to answer whether it's new, I don't think it is.
Yes. Yeah. What's that? Can't hear it. Is it new?
No, it's
It's the mobile outreach?
It's called the Comprehensive AIDS Clinic at UVM. It's been there since, I would say, probably the beginning of,
It was kind of, there's a.
were they started by Ryan White?
this was, if you remember last year, the AIDS service organizations came in because the Department of Health had cut their budget by 120,000. And you restored that. And I think unbeknownst to us, the same thing happened to the Comprehensive AIDS Clinic. And so that's what they're asking for, is really that money to fund that, if I understand it.
This has nothing to do with the needle exchange, does it?
No.
So it got cut.
Well, my question is, Rich has been spending a lot of time in this area. Do you have this in your, to restore the funding?
If this is restoring to UVM, no,
You
this
don't.
isn't exactly in the construct of it. I'm not sure, though, in the underlying budget, there is some, I've seen a money for some sort of a mobile unit in it, but I can't put my fingers right on that,
I think
that
that this
right now.
mobile unit is for patients that, HIV/AIDS patients.
Yeah,
that
there was
can't
the
come
mental
in.
health crisis.
Yep.
And then.
But there are two, there's the mental health, right?
and
Which
then
we
the-
did approve,
Yeah,
and
but
that
this
was
is,
a
and the
hard
other.
one.
Sorry, I gotta go.
Outreach is for the patients and then.
Are you done for today, Dick? or
No,
you-
no, no, I just gotta help.
Okay, all right.
And then the other half of it was to support mental health for the services within the clinic.
Well,
So
if it got cut for some reason and it never got put back, you know.
why don't we hold it and look at it? We'll
Hold it,
and
let me
we'll
go
look at,
through.
we'll look at it in the context of all the different pieces on them. There are free clinics around there in Banff, they provide care. And this is to give them an increase of funding.
Free clinics are what we should be.
Yeah.
Well, one might hope that we've got most people covered, or if you're that poor, you're enrolled in Medicaid, but we'll move that over because we thought that was kind of a basic healthcare service. Council on the Arts.
I know that one, because you had agreed that you would match whatever and they got the information on the federal grant, so.
This is a match for the grant?
Yes,
They- you have to demonstrate, the state has to demonstrate it, that you can be matched, it's very restrictive.
Okay.
They can't do
And so
anything,
we just got an email from Karen Middleton,
it has to be state general
that
dollars.
the amount of federal dollars that had to be matched had increased, and therefore the state matched it.
Yeah.
So this is,
That makes sense.
so we'll go with that.
The PEG's got $600,000 in the one-time list in the House that they would prefer to be in the base.
What's the pay?
The,
Oh, yeah.
public access television,
I
education, government.
know they'd like to be in the base, but I think you had said that the House committees have been looking at ongoing funding.
I think they're looking at the Universal Service Fund and then.
So-
and
Until that happens, doesn't it make sense to keep it one time?
Yeah.
Yeah, as long as they get the money, I think, I mean, it'd be nice to be in the base.
So,
It makes sense to see if that other thing works out.
so we funded them last year with one time. It was 300,000, this year 600. So, knowing that we're possibly it's House Energy and Technology that's looking at the Universal Service Fund. So maybe it makes sense to keep it in one time, knowing that maybe they'll come up with a better way of. No, this isn't Universal Service Fund though. This is.
They would like to they'd like to find a permanent state source,
Yeah.
but.
So they're not
because
looking at.
They're with
This
people cutting ties with cable.
Yeah,
So are they looking at the Universal Service Fund or not?
they're looking at that too. They're looking at a couple of things, including funding of public, and there was language, we had a study, and they identified a number of funding options. Because this is a declining revenue source, and they maintain that with COVID, they've done a lot more work with.
Tremendous amount of work.
So, so we'll keep it in one time, knowing that it's an ongoing cost, but one time, and maybe the work of that other committee will come up with something other than just defaulting it to the general fund. RDCs,
That was a note I had on the list of base items. I didn't have I can find a document to go with it.
no, we had RPCs.
We had RPCs and those you basically agreed to yesterday in the property transfer, so I didn't include them here as a change.
No, I thought it was the.
But I had a note that the RDCs.
Ask for more.
Well, the RPCs did get more.
The RDCs got- Yeah,
The RDCs did not. It was the RPCs.
The RPCs.
Housegate.
yeah. And the RDCs, I don't have a sheet on the ask. I just had a note that, there was $1 million ask and can't remember where it's from.
I would keep that one until we figure out.
I don't
if we're
think-
gonna have
So
enough.
we will put them on the one-time list. They did not get an increase at all in the House, so, but you don't want
I don't know. When, the RPCs are funded partly through the property transfer tax. RDCs are, how are they funded?
I think there's a baseline grant in ACCD that we get. I can look it up on the detail sheet. ACCD, you'll have it on its grant list.
Bobby,
I can't
our
remember what it
district
off the
is
top of my
different
head.
because we, other areas of the state have both an RPC and an RDC, but NVDA is both. We are the only, and actually it works really well because there's always an innate tension between development and planning, and they are able to work,
Together. and get the
together,
job done.
because in some areas you have.
Both, too. It works
What?
well. Bennington is both.
Is it now?
It's working.
And then, of course, you have economies because you don't have two executive directors and you've got,
We should be
economy of scale. Well, don't you remember that was something that Senator Luzzi tried to do? and was unsuccessful. The only response was they went out and hired a lawyer, a lobbyist, and asked for a continuation of the status quo. So it didn't happen.
So they get 1.266 in the base.
Oh my God, they want a 50% increase?
The RDC block grants are 1.266
$1 million.
existing.
That's quite a sizable increase.
And it's gonna be added to the base.
Well, the question is, do we want to do anything on this first cut? Because
I
don't,
wouldn't do it the first time.
because we're gonna have to decide pretty
Yeah.
quickly, because it's gonna compete with, we put on hold, the moving from 7 to 8%.
That's
So
why
we
I-
have money to do it, within the construct we have here. And I guess the other thing is,
You think then we should put it in, move it over?
well, I think doubling it,
It's overboard.
is
Too much, isn't
overboard, yes. But perhaps, they, with the, 500,
Do you want to put 500 in the base here? Or
What are the base?
and committee,
Yeah. That's it.
they've got it, if they want a base, I mean, it's sort of ongoing economic development. It's interesting, ACCD doesn't ask for staff, I mean, so,
The governor did do this or didn't?
no, did not. I don't
That's
believe,
why I was thinking, if we gave one-time money, it would free it up here to have for something
well, I don't think
else,
we need right now to
do that, yeah.
to free it up. It seems like they're asking for money to support their ongoing work and
Well, if the
operation.
governor didn't do it,
Yeah, he's in
maybe
it,
we should hold off.
No, they can hold off and see.
not be polite.
Even, well,
Or just do nothing in the base.
and add the request to the one-time list?
Yeah.
Yeah.
Because their request was money in the base and then supporting all the economic development proposals of the governor, I believe, was the.
well, the other thing that isn't on here, and it seems like it's an ongoing program, and I guess we're gonna have to get into our list, because we have $40 million worth of wish on general fund that is not reflected. This was attempting to deal tier 1. The League of Cities and Towns, they wanted to create a new program ongoing, it looked like to me, that would help towns with federal.
Yeah, but I understood that they pulled back on that request and are asking now for just the next round to continue to help the towns with the current ARPA. I thought that was a change, so I moved them off the one-time list, just the one-time list for the.
I thought it was to create an ongoing program was how I interpreted the last communication from Karen Horn.
Okay, I'll double check, I thought.
All right,
Just the last item on this list is, the House carried this bill in the base. The item that's, what would be paid for with this is one-time in nature, and so we can continue to carry the bill just over on the one-time side of the ledger.
That had some technology and I think it may have even had the 130 in it that we've already removed.
I think Sarah can kind of tell us what our total is with the things that you have moved in.
I have a battalion.
Oh, you have it, okay, then I can go over and tally it pretty quickly.
I can do it after.
So what are we doing with this one, Rachel?
So you would not carry it here in the base, it just creates base capacity, and you would carry it over into one time unless you decide not to do the bill, then it would not be.
And it would just
It
free
might
up.
be a Senate item. Sorry about that, I thought you were
So,
telling.
Stephanie, do you have the list of other, for example, we have,
The organic farmers,
yes,
that's on the one-time list, I was gonna organize that a little bit better for tomorrow's exercise.
no, I was thinking about the conservation districts,
So
which they wanted money in the base.
they did.
And everybody would like to have money, but a couple of years ago, we actually tried out of normal general fund, allocated over $11 million to go to water quality. And so one of the thoughts, and I will tell you, A&R doesn't like it, but the conservation districts were, when we got some slides in transportation, the majority of improvement in water quality has been a result of the work of the conservation districts. And I think that what they're asking for is a more stable and a larger base to their work. As opposed to going through the grant process, et cetera.
It's not to hire new people either, it's so people don't have to sit there in the office and write grants all day instead of out working on projects.
So one thing that we can do, and I floated it by the secretary and it got a cool response, is saying, well, everybody would like it to be additive to what we've got. And I was like saying, well, we can't continue, but should we, sort of like we've done in other situations, say out of that funding, 1 million would be allocated to support the work of the conservation districts to undertake work that will assist or result in the state's reaching its water quality goals. So that was a way of getting out of that being a grant supplicant to, not that they couldn't do grants as well, but to have at least a predictable level of support for their work.
How did they get it then?
Well, they give them a very small amount right now, 100,000, 112 or something. So it would just simply go through the same funding mechanism we have, which I believe is ag.
Yeah.
But a lot of money gets transferred. So of course, the big thing is we are breaking with the water quality committee that reviews grants and determines who gets what. And so that's the question.
That's a wonderful idea.
I should have had that on the list, I think it.
Well, it's all right, Stephanie, can't keep track of everything.
Well, because we were talking about it in language, I forgot to put it back on. For the general fund.
That is, they made a request, and of course they said, well, we had more people come and testify than anybody, so of course we should get money.
And I think the request was 2.4 the base.
I know. And they wanted a position and they wanted some one time. So.
I think the childcare, we don't know.
With the number of people there? I don't know, I'm only telling you what they sent me in an email.
Oh, they
do. So tremendous number of volunteers.
So the question that I have before the committee, and we have some draft language would do this, is to allocate $1 million out of that clean water revenue, and which we had, well, as Tim Ash was chair, I remember we were over in joint fiscal and we were calculating, and I think it's about $11 million that we allocated specifically because we're having to deal with the TMDL in Lake Champlain. And I know that ag sector is one of the major contributors to the water quality problem. So it seemed like a natural connection. So we do have some language that would do that. It may not see the light of day for all I know, but in terms of being enacted, but I think
I'm trying to find it, I didn't print it out to bring it over.
I think maybe the drafter is standing behind you.
I am, but I did not bring the language with me. I'm here on the other issue.
Do you remember when I said?
Oh, on the testing? Oh my God, I feel like I'm in a Fellini movie on that one.
Yes.
The PCB testing for more than schools.
Oh, yeah, geez.
But I continue to be totally confused by this because you're
But
reading.
the Secretary of A&R tells me that the way that we worded it is that testing is required.
So I have more information on that.
Okay.
So,
I mean, I thought we looked at the language and it was extremely clear.
But that's only one section.
Okay, but was there mandatory test language elsewhere?
it's incorporated into federal and state requirements when there's a transaction and there's a potential release. When you do an environmental assessment, you have to notify of the potential release, of the release or potential release. So it's not the language that you saw for mandatory testing.
Okay,
It's a already existing law that they say this change will bring these buildings into it, and they will have to then do air quality testing for PCBs to determine if there's a release or potential.
And all
It's not
the years,
state mandated testing, it's.
all the years I spent on the school board, air quality testing was our responsibility.
But
We
this-
hired people to come in and do
But this
that.
has to do particularly with buildings that are being through the housing entities.
Right.
They're being rehabbed and they're all older buildings. And many of them are, well, the one that was brought to my attention is one that's just had a $15 million renovation. And then they were told that they were subject to the PCB testing. And,
Why wouldn't they?
well, the
Why
Pleasant
wouldn't they
block
be?
would probably be right up there too, Doug, as well as a number of, well, any of them. Most of these, particularly downtown projects, are older buildings. They're historic buildings, and they certainly predate 1982 or whatever that.
1980, yeah, 79, 80.
80, okay. Do you have that, Stephanie?
I just sent it to Chrissy. There was a couple words that Mike suggested we change, so hopefully she can print it out in just a moment. On the, are we going back to the
Yeah,
water?
yeah.
Are we saying that developers don't have to test for
So-
PCBs?
Well, that's the question, I guess. I'm getting it from our local housing. I don't know who you, and I also, who was the other woman from Evernorth?
Right. She's a housing developer.
Yeah,
a
Kathy
affordable
Meyer.
housing developer.
Yeah, but I mean,
So,
living in an area of contamination, I'm a little worried about.
So I have some options for you.
okay. And they say the language we put in the budget last year is what created I realize there's some other federal law, et cetera, but it's what created this testing requirement that we didn't know we were requiring. So do you want to switch to that, or since Mike is here on both really, as the drafter of the allocation of 1 million, we can float it by and then, you know, probably it'll be hit with a barrage of
So you get a forwarded email, Chrissy, with an attachment?
Not yet.
No, it's pokey. Sometimes when you have the attachment, the mail is pokey.
That's probably scanning it for.
Mhm.
Stephanie, while we're waiting, have you checked the miscellaneous judiciary bill contains new fees that I believe the administration will support for sheriffs in their service, which hadn't been upgraded in like 15 years. And Dan Dickerson's estimate was 100,000 plus of new revenue. So I'm curious if anybody's mentioned that to you.
Now, the judiciary fees generally go into the general fund, right? So.
Yeah. It's general fund money, and it is, Dan estimated, and I can't remember the exact number, and I can't find it in my, but the miscellaneous judiciary bill is in the Senate Finance Committee now. The administration doesn't oppose this increase because it's, you know, the sheriffs and
Okay, so I've
none of
got,
the revenue goes to the state. And
Those aren't fees that are corralled for anything else, they're just general fund?
yeah, They're fees that, you know, for service of, you know, you're being served by a,
For non-payment of something.
well, you're served for this or that, you're served, whatever the service fee is. Right, and that, I don't believe there's much opposition to it, at least in the Senate. So it's going to be added to it was added by our committee and it's now in finance. Adam has gone over it. So it would be, I mean, it's not a big chunk, but every little dime helps, so.
Okay, so you think it's about 100,000?
Well, Dan estimated 100, I think it's 115, but I was looking for the document and I can't find it. You remember, Adam?
I don't remember the number, but I can find it. It was for fingerprinting as well as summonses, so.
But I don't think we get any fingerprinting fee.
I think those. fees are gonna change too, but you're right, though, the administration is fine with it.
So we'll
I'll
check and
find
see if we can add that to a general fund source.
Yeah.
Well, I'm just saying it's, I mean, I know it's a little bit, we'll
Well,
look,
look, when we're down to the base budget, this used to be not little. So somehow ARPA and all the federal money of this distorted our sense of what's little and big. But for our base budget, little is still little, big is still big.
well, comparatively small, but at least it helps with some of the decisions we have to make.
Okay, all right.
Is able to print out that amendment on the conservation allocation.
All right.
You know, the draft.
Then Mike wrote.
Sit down, Mike.
I'm good right now.
I think he's ready to go war.
But did we finish what his options were on the
No.
PCBs?
All right.
We need to skip around a bit.
No. Do you have a preference what you want to do first? The PCB options?
Yeah, let's do the PCBs while it's
All right.
fresh.
Okay. I think Stephanie's anxious to relinquish her chair.
So this is like agree with legislative council. You might remember last year in Act 74, the big bill, there were 3 sections related to PCBs. One section was an appropriation.
Somebody just text you, Gus. Are you psychic?
Came in the 10 minutes ago. I guess I'm psychic.
Oh, okay.
There was an appropriation of $4.5 million DEC to conduct indoor air quality testing in schools for the presence of PCBs. That language had some ambiguous provisions in it about getting guidance on how to do the testing. That's being dealt with in House Education. That's going to wind up in the miscellaneous education bill. What we're talking about is not that requirement of indoor air quality testing of schools. The other 2 sections in Act 74 amended the definition of the term release in 2 different places, one in the Environmental Contingency Fund and one in the definitions that are relevant to hazardous materials releases. That's important, especially when there's federal funding that is used for financing of a building or modeling of a building, et cetera, because there are requirements for the notification of a release or a potential release during that, when you are financed with those federal funds. So that means you have to test. And you either do that testing as part of your environmental assessment, your upfront testing, or you then do some sort of back-end testing to determine whether or not the PCBs are there. That is a concern for private developers because of what it potentially means for them if they do discover PCBs and if they are required to respond, because there's a whole chapter of law in federal law, and it's a very esoteric chapter about how you deal with PCB waste and PCB remediation waste and PCB construction waste and PCB You get the point. So you saw language that proposed changing that definition of release so that it only applied to PCB air quality releases in school buildings. Well, they didn't define what school meant, and as everyone knows, there's several different definitions of school and statutes, whether or not that includes public schools or independent schools, et cetera. So that would need to be clarified. So if you wanted to go forward with that option and just limiting the release provision to schools, you need to clarify what school means. But there's another option, and that is to pull that back, and instead of it just being schools, it's some sort of public building, state-owned building, municipally owned building. So it would remove the issue from private developers, at least for the time being. Allow A&R to go forward with some of the actions that it's proposing, and then have A&R report back on how they want to deal with all the kind of detailed issues with the private developers and testing PCB. So Senator Sears, it wouldn't totally eliminate private developer testing, but it might delay it. And that's what the third option would be, really, is to put in a notwithstanding clause on that release language and say, hey, notwithstanding that for 2 years, you're not going to be required, anybody's going to be required to do.
I'm sorry, I'm having a hard time hearing.
For some amount of time, no one is required to do the PCB testing for transactions until A&R comes back and answers all the detailed issues regarding transactions for those environmental assessments and subsequent testing.
Mike,
Senator Baruth and then Senator Sears.
I just have a clarification question. So previous to that big bill passing, that status quo was what in terms of?
You did have to do a release for you had to do an assessment for hazardous materials releases, but they weren't testing indoor air quality, because indoor air quality is kind of an unusual component. A&R doesn't have a lot of authority over indoor air quality.
Okay, so your first option that you laid out, where we make it clear that we meant that indoor air quality release testing would be just for schools. That seems to me like what we should be doing.
That's what we intended to do,
Right.
But see, this is broader than just schools, because that release language can apply to any PCBs that are released from building materials, and the ability of the state to go and seek liability for their cleanup. And remember, in the medical monitoring bill, you changed who could be liable to include those manufacturers who manufactured those PCBs and didn't provide adequate notice of their danger when they knew or should have known of their danger. Monsanto or the other PCB manufacturers, they are subject to liability under that medical monitoring.
Yes, but in the medical monitoring bill, we didn't require mandatory testing. We said if in the course of, discovery, it's that discovery is made, but we didn't require the testing.
No, and so, right, the testing for release was already part of the environmental assessment component.
Right, but what I'm saying is, why don't we go back to the status quo prior to the budget language that we wrote and make it clear that the only change we were trying to make was on school buildings and the mandatory testing program there.
So I don't think that that's what A&R intended with that language. I never thought that they intended to just limit that release language to school buildings.
Did that come from A&R?
Yes, it did.
And of course,
It
and it was
first
up
was,
in the budget, and I think,
it was first circulated in February last year, but it really didn't get any kind of traction until May.
who took the testimony? What committee took the,
It was-
really thoroughly vet what, huh?
It was natural resources.
Well, it first went to Senate Education. And then when Appropriations was asked to put it in the bill, you asked both bodies, natural resource committees to look at it. It only got about 12 days of review.
Which for something that has so many implications is a disturbing place to be.
Well, that is, I think, one of the options is you just pause it until you figure out everything that needs to be determined.
When you say if, pause it, you're referring to not the mandatory school testing program, but the others.
The other mandatory
Yes.
testing under the environmental assessment.
I'm a little disturbed that something of such significant magnitude, you can present the language, but it seems like comes with it as a responsibility to inform us what does it really do? I don't know. Obviously, we were trying to accommodate the school testing and put it in the budget, and we never had a clue.
Well, I can see that you probably did not hear about this environmental assessment component. I do have emails with legislators about why did they need it. The fact that A&R doesn't have a lot of authority over indoor air quality. There's called secondary PCB contamination, where the dust and the caulk that breaks down kind of adheres to walls or floors, etc. And that's not clearly a release. And so they wanted to have the authority to respond to that as well. And so that I concede that you probably didn't, the bodies didn't have enough time to
Well, we weren't here.
digest this.
Last February, we were all home working off Zoom and,
Well, that's
I
true.
mean, you didn't have the opportunity to.
So, all right, yeah,
So,
go ahead.
Speaking for myself, I don't want to go backwards on the mandatory school testing. And it doesn't seem like that's where the complaints are coming from anyway. So I think we should let that stand. And then if we pause the rest of it, that wasn't our intent anyway. So we're not interrupting anything the committee intended to do. We're interrupting the unintended consequences. So that seems like a way that we can do no harm on that piece and allow the other to go forward.
And then you have A&R report back on how they would implement that.
Exactly.
And then we can say that with a more informed understanding,
Whether or not you.
whether we want to do it or, how we would do it.
So that's ignoring them in public buildings, right? This would just be without them.
Well, if you just do the pause and just pause it, you just pause it for,
Everything other than
Everything.
schools, other than schools.
you can, well, the mandatory testing for schools is in another section.
Yeah. Oh, okay, so that
So we
can
do it
move
all.
forward, it's only that others,
Yeah.
how did that get stuck in there? Did
Well,
you do that, Philip?
No, but I do know there was, in terms of the environmental contingency fund, there was an attempt to use language to broaden that so that it could speak to PCBs because it didn't before. And so maybe that's where the trouble goes.
Basically what it.
If I just might just comment, and obviously my views on chemicals have changed a lot in the last few years. But you're talking about places where people live, and I just think people deserve to know what chemicals are in the air and any dangers that might be there. And I realize we put it in inadvertently, but now taking it out, are we protecting those that are going to be living in these, developments that nonprofits are doing or for-profits? I guess that's my question, and I would love to hear from, I realize this is moving quick, but what am I missing, Mike?
It's actually an interesting dynamic because if you're a building and you're not subject to the federal financing requirements and this language goes in, you now kind of have this quandary. Do I do an environmental assessment? Because if I do and I find out the PCBs are there and I have to, why would I do? So are you actually limiting what you could find out and notify of the people that are living there, it's,
Yeah.
you're gonna put some private property owners in a position where they're not sure they're gonna do the environmental assessment. That might impact their ability to get financing, but.
Well, well, you know, I don't know what to say, honestly.
Yeah.
I just, I hate to, if you shouldn't be going to school in a place that's got PCBs, you shouldn't be sleeping in a place that has PCBs.
Yeah, I mean, that's, when you look at the standards, a high occupancy or low occupancy even, the standards are pretty low for what EPA recommends.
Yeah, they are very low.
Is there any kind of mitigation similar to what you can do for radon, something like that?
Well, when you find it in the building materials over 50 parts per million, you're required to take it out and then dispose of it as hazardous waste, bulk remediation.
And the issue is for buildings that have been completely redone, which was how it came to my attention, a $15 million was one of the more expensive restorations and rehabilitations. And then you've got your historic building, the historic building requirement to do it and be told you have to do it after people have actually moved in. It really caught everybody by surprise. And the fact that if we want to get housing, and I'm sure that we must have a lot of private, in the, well, or the apartments that we're paying to bring back online. I suspect that this is could be very far reaching in terms of housing being taken off the market, frankly.
That 30,000 a unit will have to be doubled.
Well, I don't know.
So should I work with the interested parties to come up with some language?
I think we need, to, I know that, and Adam McGrath and you have had some email exchange.
Right, so I've been in touch with the attorneys for some of the interested parties, and I prefer that they're more knowledgeable on the issue. But bring in Chapman and the attorney for the party, maybe BHCB, and work out some language.
Well, if we can consider, ultimately we may, but I think it needs to be in a much more informed and a much more detailed forum and testimony. If you're going to put in something that you think about the housing stock in Vermont and the age, and not only what VHCB might be doing or, our local housing entities, but, we're putting money into privately owned apartments to get them brought online. I just don't know how broad this net is. And so the thing that it's obvious that if we're caught by surprise, it was not done as a result of a deliberative due diligence, but it was, and it doesn't mean that you don't end up there, but it seems like you were saying, it really does need, it really needs, it warrants a very careful examination of what it really entails.
And if we pause that unintended part, we're not pulling it out. We're not making the decision not to go forward if that's the recommendation, but we're just saying it escaped the normal oversight process.
It escaped. That's it.
Yeah.
Okay, so.
Thank you. And so you're going to continue to talk with the affected folks and more knowledgeable people.
And I mean, I don't know if I'll have it done by Friday.
That's okay.
But
sure we can figure out.
So we
could do it on the floor, or it could come in conference.
All right.
Yeah.
Okay.
Yeah. We recognize that Friday's kind of short.
Right. I mean, with the complexity of this issue and the interested parties, I doubt we can get consensus.
No, I'm sure not. All right. Well, thank you for what so far.
And then the issue of the $1 million, this would direct the Clean Water Board as part of their annual recommendations to you for appropriation of the Clean Water Fund to recommend at least $1 million from the fund to be distributed on an equitable basis to the conservation districts for their activities, outreach, education, monitoring, assessment, planning and design, implementation of local projects. I would not say stormwater management, I would say water quality.
Yes, I agree.
Bring that up, the water quality.
Because, especially on a farm, it's not always a stormwater management issue. It might be a fencing issue or stream banks.
And I think also it ties back to the whole purpose of the water quality, so I think that's.
Yeah, that's gonna be in there.
And so that's all. But I mean, it's basically off the top of any recommendation from the Clean Water Board, they're gonna have to make a $1 million recommendation to the conservation.
Well, it's not what they want, and it's a lot less than they wanted, so.
Everybody knows
Thank you on the other.
Okay. Thanks a lot.
Thank you. Even if we don't get it before we move the budget out, there are other ways that we can.
Yeah, I'll go float the need to work on it with Matt right now. I'm sure Gus is gonna be in the hallway. I'll ask who
I'm sure he does.
to talk to.
It's amazing how people just appear in this room.
That must have given him
Time of year, right?
All right, great. Thanks a lot, Rob.
Anybody that's doing this development.
All right,
so.
Out there too.
All right, so are we happy doing this?
We
won't
that
do that
one
in
little
budget.
word change.
Just and water quality. No. Maybe we need to make it more than just at the end.
Move it up on the list?
Oh, yeah, I mean, really, what we're asking them to do is is really related to water quality.
I'm already getting emails about the
It speaks to the-
2.8 million into the E911 from the,
So we've got emails.
So when we went through the
you got it.
E911, the $2.8 million of existing balance of activity, that we were gonna take 1.3 to help E911 get through 23, or leave in universal service fund to cover E911. I think you're getting reactions to that.
But we took 1.3 of it, not.
You left it, you were,
Left 1.5.
you would leave the whole 2.8 in the universal service fund, but 1.3 is what would be used for E911 and 23. You can be specific about how much of the 2.8 would take. The preference.
I would see the emails, who's sending them?
I got my CD.
Bud. Yeah, it came to all of us. It's from Jane Campbell, this one.
The two, they came from the director of the CD in my area, and Jane Campbell was chair of the board in my area. So we took 1.3 of.
So there's this unspent
And I
balance.
just need to.
So my understanding is an unspent balance in the
Universal service.
in the connectivity part of the universal service fund at the end of 21.
Yeah,
That is not budgeted in 22 by the board,
yeah,
so it's still available.
yeah.
The proposal that you agreed to would just leave it in the universal service fund, and of that 2.8, we would use 1.3 to cover E911. You would be silent on the remaining 1.5 until you get the budget from the.
But the 2.8 was not ever appropriated for them to spend.
Well, it's not budgeted in 22, and it's not, as far as I know, budgeted in 23 at the moment. It is in the connectivity initiative.
So
arena.
they couldn't spend it anyways.
They could probably go through excess receipts to try and spend it, but it's not, as far as I know, it was not budgeted in
It's
any
money
way.
that's not been appropriated out of the Universal Service Fund, for that purpose. It was surplus at the bottom of the Universal Service.
It has not, prior to the changes when we created the board and et cetera, it would have been eventually sent out in grants in some fashion. It just has not been allocated to be used yet. It's there at the end of 21 and it doesn't have a programmatic budget around it at this point.
And when we had the director of 911, the way in which the percentage worked, then it meant that in the sequence of funding, they were the ones left short in terms of the adequacy. So, and as the money has declined. You're right, we're just gonna sweep the excess. And part of it was because there was so much more money going into broadband. We've got 95 million. We've got another potentially 100 million. Plus we'd already done 150. So in the scheme of things, it seemed like that was an area where we could relieve some pressure on the general fund simply because there'd been such a large infusion of federal dollars to support the broadband.
I'm just
saying that was why when we're talking about should we change sort of that funding sequence because of the fact that so much additional money had come in since that percentage was created. It was a pitiful amount.
I'm happy to, I need a little bit about the ARPA and the funds that we put towards broadband and all its are paid.
Well, I imagine somebody's listening if the word has gone out, so we need to answer it for everybody.
Yeah,
And
I understand that, but if I put something together for her that other people can use it, so.
Yeah. Maybe we should do it through Christine. Are we hearing from Christine?
Yes.
She did actually write as well.
Okay.
And now I'm getting it from Jennifer Pullman, the executive director of this crime victim service. I mean, it's out there. They don't want this.
Yep.
Oh, they don't want any of the funding?
Well, no, they don't want the advocates. They want the money going to them, not the state's attorneys.
Even though the state's attorneys employ the people and have to pay them? Then what do they want? The money to go to them and then
They want the general fund.
and then it would go over to the state's attorney?
Within 5.
That's the preferred method for this.
Well, it made sense when it was the bulk of money was there. Well, we'll have to have some discussion around it.
Yeah.
So,
Well, I think they're worried about how the Department of State's attorneys and sheriffs will use the 2.5 million.
That's the concern, that they would, if over time, somehow not feel redirect or something.
The language was
it
tight
seems,
and
I don't know, it seems like that is a protection we don't. The more we have an internal service deficit, the more the risk is as well. So it's kind of hard to fathom. I want to control the money.
Let me try to talk to Jen tomorrow morning.
Okay, I mean, to me, the victims advocates have been just an integral part of the state's attorney's office. So this idea that somehow over time they would get defunded, maybe there's some way that we can put the language. It just seems crazy not to put the money where the cost is. And if there are employees there, our standard practice is that's where the money would go.
It also.
And it also means that we are not very vigilant. If we were or we would be making a deliberate decision to agree that those positions, the funding for them is being cut.
Yeah.
So it all has to come back here to the state budget in terms of And I can't believe that the victims advocates would not be very quick to point out that the budget being proposed by the
New state.
new state's attorney, if it's being cut.
I think it's likelier that under this new arrangement, they would have more advocacy for more funding down the road.
They would have.
You know, as opposed to the state's attorneys cutting them. It seems like, you know, we would get more regular requests that we would add.
Well, obviously there are advantages or disadvantages, but normally we would put the funding where the cost of personnel rests. We've just been able to use that both of the funding.
I think, let me talk to her and see if I can't get some better understanding of their concern. And I think we're in the right direction. We're funding it with general fund based money, which means they don't have to go out and, you know, worry about whether or not there's enough fine money or surcharges and other things.
Well, that's our whole motivation for this. And I don't think, is it standard that we would appropriate to somebody to transfer it over?
No, I mean, constructing in tight budget times, and then I remember the years back when Jim Reardon was commissioner, he would not fund the pay act increase in the center. They'd have to absorb that to send it over to the state's attorneys.
And that was a source of concern and complaint.
But articulating the concern under potentially a new state's attorney, director of the state's attorneys and sheriffs, I think might be how do you have it, whatever concern is around that.
Well, I think they could do let me talk to her and we could try to do try to get them to do a memo of understanding. And I know John Campbell's more than willing to work with Jen.
Okay. Thank you for doing that. Obviously, our intent was to really deal with a structural deficit and make sure that those resources were in place. So I guess I'm really kind of appalled that the prospect that the replacement of John Campbell would not value the resources in our desire, the legislative desire here to make sure that they didn't get it.
Stabilizing the rest of the
They
center.
didn't have this continued instability and the work. And normally to fund the positions where they're lodged is where we put the money, because that's where they get paid. So if you can work it out, that would be appreciated, because,
They'll have to put,
well, I might need to do it, I don't know.
I mean, the buck stops here and they ought to know that.
Well, I guess the other thing is for us to pony up $2.5 million of base dollars is a very, very significant step forward. And so if somehow that is, I don't know, maybe, do we want to reconsider it? I don't want to do that.
No.
So if there's some language that we can put in that gives some confidence on this, but I would say that legislators, when we make budget decisions, if we didn't deal with that deficit, we might end up cutting, to be honest.
Yep.
So this idea that somehow there is a vulnerability with the current situation is.
Maybe that's what they want us.
Well, I don't know. So now
Let me see. I still believe.
Planning on the money.
I still believe we can work with them on this. And if there was ever a good time to do it, John and Jen have known each other for years and they work well together.
All right.
Is somebody saying that Campbell is leaving, or that was
I think
just a
he's
speculation?
retiring.
He is
Oh,
retired.
he is? Oh, when?
It
Soon?
must have been a good job if he's retired.
Okay. So we're gonna have to go back and reconsider what we do with 911, because apparently, but they don't have the authority to spend. They have to get excess receipts.
Well,
or maybe not.
yeah, I don't know where their spending authority would come from. Are they saying they've actually budgeted them somehow?
Yeah, they're saying they were planning to use them for match.
They didn't have the spending authority. How could they spend
But I
it?
also think they have the existing 0.4%
Maybe
for the
you must
match.
retire, not play.
And the art,
Take the.
So-
We'll just have to take a look at.
Yeah,
it.
yeah.
I thought that was actually more than
It was still practice law, right?
we don't need a match for any of the ARPA, and
Well, even if they had excess receipts, they would have to get it out.
Well, from the administration.
From the administration, at least.
Unless they had carry forward authority, I don't know.
so that.
It says that it's a non-federal match to construction funds. So I don't know
I mean,
where the match is required.
Yeah.
The only other
I always
federal,
thought that was.
besides ARPA and the IIJA, the only thing I'm aware of is the Northern Borders. I was told that the 0.4% that they have,
Okay,
which we're not touching.
Yeah, you never.
so this was,
Maybe they,
well, we need to figure it out.
Yeah. Are we,
because, and we can limit it to, I mean, the 1.3 is necessary as well as the.
are we done?
No, you mean for the day?
It's 6.
Well, there's one, you have one piece of, the childcare language.
Yeah, it is.
All right, we're gonna have to,
What little piece, what?
So if you would, like, we can put the childcare language down, we can get through that pretty quickly, I think. And then-
on the childcare study, that, and the stars.
I have to wait because I sent it over to DCF and
They
they
haven't
got
got-
back to me and said they had concerns.
Okay.
I told them that I couldn't meet with them, please put it in writing, and I haven't seen anything.
Well, maybe we should just
back from
delete
this.
it and then you can work in some substitution because the House version's got it.
Well, by morning, I
All right, all right.
it shouldn't take too long.
They want changes? Is that what you said, or they just?
They want
change?
changes.
They want
They don't
changes.
wanna, the truth is, they don't wanna report back about changing stars.
All right, well,
And it's a big policy shift.
it sure is, after we've been told that
For 2
stars was the gold star of childcare quality.
Basically, the language says that they would have to bring something back to the policy committees. And, as we did the budget, next year, and they couldn't move ahead with a change to stars without approval.
Well, they've already stopped it now. You.
Well, they haven't really stopped it. It's in an interim. As of July 1st, the contract with the Family Center in Middlebury, they went on for the next year internally, internally, they will do reviews to any childcare that appeals to them and says, our situation has changed, and they will do that. For everybody else, they'll be held harmless. So for a year, they have a plan and it won't change. What they are working on is changing the policy around what stars, whether.
And we're
they keep
relying
the
on
system.
Phil to grasp all this.
Oh,
All right, so we're waiting, we'll hold it until our brains are fresher.
Well, and I will wait, get the feedback from them before.
All
I
right,
put
so
it
the
on the table.
discontinuation of the star system is a very significant change.
Yes,
And what we're saying is we would like to know, well, first of all, the rationale.
and what the policy changes.
And how they're going, what will be the replacement?
Yes.
Relative to.
How about the poor people out there who are
Yeah.
running all these centers who are doing childcare? And
And
suddenly the stars thing that they've been working on striving to get more stars is suddenly
Years.
kaput.
People who are in the process of upgrading.
Yeah.
All right, so I guess then we'll wait and see what the
Education
language
courses,
is.
yeah.
Since obviously it has driven a lot of our financial, the compensation levels and so forth are all been tied to that.
Wonder if they even know it.
So do you
Back
want to
there,
go
now
to
get more
6?
education, so they
We
can
need
move
to
up.
give a list of additional base requests for funding, so we can look at it. We do have enough money here for what obviously is
What we
unidentified.
Yeah.
So the question is whether we,
One times.
one time, no, but also.
Oh, there were
anything-
some things we.
Yeah,
You did not move over.
Yeah.
And
Well, then that's okay, let's look at the.
you have, that's that, with what you moved over into the column, you have $12.9 million expended.
1.9?
Yeah.
That's without the 8%?
It's with the 8%
Okay.
included.
Well, we don't have much more than that. No? Okay.
And the base you do not, although we did get the fee piece, I don't know where that fee, the H2 729, I don't know if the finance is moving that, but if the annual revenues on the state share for the sheriff's fee proceeds, that's 112, if it's at 75 to $97, if it's at 65. And the fingerprinting would give us more money if the fee is increased from $25 to $35. It would give us $245 more.
$245,000?
Yeah.
He said $245.
Sorry.
You know, the one for.
I didn't realize that the state received fingerprinting money. I didn't know we got a share of that.
Oh, they do for security, you know, they fingerprint just about half the world, you know, school employees and, you know, volunteers, drivers and everything all have to.
Well, it left our committee at 35 and what was the other number? 35 for fingerprints and 50 for service, I think.
Well, service would that, so service I think is the same as the current level, it's a $50 current level. So the two options it looked like for the other sheriff's service was going from $50 at current to 65 or 75.
You remember, Alice? I think we did 75.
We
Well,
did
this is-
75
this is
and
what
then the other one
fiscal
went.
note said.
Okay,
There
so-
were two that went to 35.
So
Yes, there's two different fingerprinting charges we saw in the laws. One is $15 for teachers and
$30.
35, right?
So we raised that one from 30 to 35.
Yes, and we raised the teachers from
It looks
15
like you
to
were at
35.
Yeah,
okay.
Teachers are 15, the janitors 35.
yeah.
You know, we need to make this
But now
more than
it's-
substance use disorder
It may have
though.
been school employees, right?
Yeah.
That was 15.
Well,
I
we're
was saying
talking about a
janitors.
whole lot of prevention, whether we're talking about smoking,
They
whether
have
we're talking
been-
about obesity, whether we're talking about.
Well, I wanted to have to,
I heard no money.
I think you do. So
Yes, I
think-
do.
Saying there's money there and I don't know what finance will
All
do
right.
with the
Well, I'll
amount.
check with Ann on it. Obviously, what's on the fiscal note is what you passed out.
Right.
So we've got that. So we'll see what the total is for what you passed out, and I'll check with Ann if she's gonna move the bill. Because it'll give us a little more money.
I got
It's about it looks like about $350,000.
That would help fund your,
when I,
you know, that would fund your
Pathways.
pathways, so we can stop
Help.
getting emails.
Our chief,
Yeah.
that's where he's gonna
Okay.
do it.
All right, maybe we should look at that
okay.
before we pass it out. Because I do think we should, that was the whole reason, rather than, all right, that's what's coming in tomorrow.
That is what.
All right, so,
Concerns.
So committee, I've just realized it's 6 o'clock, my time is away. And I'm going to adjourn the committee for today, and we'll start in again tomorrow. We can look at additional, but obviously if we accept what we thought, sort of based on our committee discussions as what would be the first tier, we don't have a whole lot of money to work with on base.
You want me to have Michael move the water quality language up higher on that list?
No, that doesn't take any money. That's allocating money that's already available.
Yeah, but
The way it's drafted,
the
you
way,
want
but
to
yes, yes, I
you want
guess.
to, you want to say for water quality activities.
Yes.
And then the end,
Yes.
we'll.
I'm sorry, I thought you meant moving it up on my money list. And I was
we could do that
No, Bobby.
too. You're not.
No, if all goes well, I'll see you in person. Thank you.
Knowing Senator Starr, I mean, so I'm going to adjourn today.